Dr. Sanjay Gupta, CNN's chief medical correspondent. Sanjay, so great to see you as always. Donald Trump is the oldest person ever elected president in the U.S. He's about to turn 80. What do we know about his health?
Well, we know what they've told us. And that's the nature of when it comes to health reports. Obviously, we can just go by what they tell us. As you mentioned, Pamela, he's had 3 visits over the last 13 months. One was a scheduled visit. We knew about it. That was in April of last year. And here are some of the things that we learned at that visit. Obviously, his age, his weight, slightly elevated blood pressure, has some sun damage, which we can talk about, to his skin. And then that cognitive assessment exam, that Montreal Cognitive Assessment Exam, which he's talked about having taken a few times now and always scored perfectly. He's on various medications, most of them for cardiac sort of stuff, statins and cholesterol-lowering medications, and then that aspirin as well, which he takes at a much higher dose than would be recommended, if it's recommended at all, 4 times higher dose. Family history-wise, his father had Alzheimer's disease, passed away of that at age 93. I think had symptoms 7 or 8 years before he passed away. But that's kind of what we know. And then again, a visit in July to assess, at that time we were told what was going on with his legs, and then again a visit in October, which we weren't told about, and then got a report 2 months later about what those exams were. So it's a cloudy picture, but that's kind of what we know.
And there has been so much made of the bruising we've seen on his hands. He says it's because of that aspirin he takes, and you said he takes more than what most physicians would recommend. Tell us more about that and what the concerns might be around that.
So, first of all, when it comes to using aspirin at all, the question is, does someone have some reason to be doing that? Is there some history of heart disease or something else that would warrant that? And again, we haven't been told that, as you just saw in the clips earlier. He said he doesn't have heart disease, but he's had tests that have shown heart disease, but they maintain he doesn't have heart disease. There's this back and forth. So that's the one thing. Should he be taking it at all? Second of all, again, the dose. If people are taking it, 81 milligrams typically is the dose, and there's concerns about bleeding. Maybe that's causing some of the bruising in his hands, but also concerns about bleeding internally. He's taking a dose that's 4 times higher, 325 milligrams, which is an adult dose of aspirin. He says he wants really, blood that just doesn't clot, but there can be concerns with that in terms of bleeding, and I think that's the back and forth there.
The president, Sanjay, was diagnosed with what's called chronic venous insufficiency back in July. Here you can see the president's badly swollen ankles. Look at this. Yeah. See the pictures there. How concerning is that diagnosis?
Well, if it is what they say, chronic venous insufficiency, that in and of itself is not that concerning. Relatively common, 1 in 20 people, I think, on average. More common as you get older. Think of it like this. The blood is pumping blood through the body. If it's pumping well and the veins are returning the blood well back to the heart, you shouldn't have swelling. But sometimes those veins become insufficient, so the blood tends to pool in the lower legs and in the feet. You may see that after long plane rides, for example, in people. But the question is does this have something to do with this heart? And I think that's what sort of prompted that exam back in October, and maybe some assessment again today. White House has said, no, this is just veins that are insufficient in his lower limbs.
All right, Dr. Sanjay Gupta, thank you very, very much.
The president turns 80 years old next month, and questions about Trump's physical and mental fitness have followed him since before he entered office. You will remember that letter from his then personal physician back just in 2015 that famously stated this: if elected, Mr. Trump can state unequivocally will be the healthiest individual ever elected to the presidency. It was later learned that Trump dictated that line himself. But in recent months, now fast forward to today, the White House and the president have been fielding new questions about some of the visible injuries like bruising seen on the president's hands, swelling at the president's ankles. The White House explaining both as minor and benign issues, but questions persist as this White House has long been, at best, opaque about the president's health. With us right now, CNN medical analyst, Dr. Jonathan Reiner. It's good to see you. And worth stating, of course, Dr. Reiner, as you well know, as you've worked with and around White Houses in the past, that presidents are not legally obligated to release anything about their health. Whatever is disclosed is done by choice. But still, what should happen, would you say, with this annual physical for the president? How should the exam be different for a president who is turning 80 in June?
Yeah, well, Kate, this is really a tradition. The tradition for the annual physical exam really was started by Richard Nixon in the aftermath of Eisenhower's large heart attack. But the president and his team are not legally required to release information to Congress or the public, and I think that really should change. There are so many roles in our society that require annual assessments of physical capacity. Pilots, Secret Service agents, school bus drivers, and for the chief executive of this country and the commander in chief of our armed forces, we should have a clear understanding that the president is fit for duty. I do want to see this, during this examination, a credible explanation for his visible health concerns, his bruising, which initially was described as due to vigorous handshaking, which is not credible, his severe edema in his ankles, which was described as chronic venous insufficiency, when just 3 months before, 1 year ago, his examination disclosed that he had no edema, which would then make it acute venous insufficiency, which is an entirely different thing. And finally, the president has severe daytime somnolence. He falls asleep very often. He's fallen asleep in the Oval Office on multiple occasions with people talking to him in the cabinet room. And there was concern yesterday that he might have fallen asleep at Arlington National Cemetery during Memorial Day observances. And chronic insomnia is a severe illness. It can result in an increase in risk of dementia, decrease in cognitive effects in older people. It's equivalent to about increasing your age by about 3.5 years. It increases your cardiac risk of having a heart attack or developing congestive heart failure, and it can produce a decline in your sort of mental functions, like it could increase depression, anxiety. So it's a real problem, and the president appears to struggle to stay awake during the day. And I'd like to hear what the White House has done to evaluate why the president has this increased daytime somnolence and what they're doing to improve that.
We have also, Trump back in January, I was looking back, he had told the Wall Street Journal in an interview, Dr. Reiner, that he actually regretted getting the cardiovascular and abdominal CT scan that he did back in October because of speculation that it sparked. And at the time he told the Wall Street Journal in an interview, in retrospect, it's too bad I took it because it gave them a little ammunition. I would have been a lot better off if they didn't, because the fact that I took it and said, oh, gee, said, oh, gee, is something wrong? Well, nothing is wrong. And he seemed to be presenting something of a catch-22 of you want the president to be getting frequent checkups, especially when the fact of the matter is, as you get older, you do face medical issues. People in their late 70s and 80s, they will have medical issues. There is no escaping that. But then saying that every time he does, it sparks some wild speculation. What do you make of it?
Well, first of all, we've never had an adequate explanation of why the president went to Walter Reed in October for off-cycle testing. The president's team hates taking the president to Walter Reed, and they only take the president there when there is testing that they need to do that cannot be accomplished at the White House. The White House has a prodigious capacity to test and treat the president and his team. So you only go to Walter Reed when you need something like a CAT scan or an MRI scan or some other invasive modality. And it's never been adequately explained why they took the president there. His physician later said that he went there for preventative testing, which really makes no sense, because it creates the kind of concern and speculation that occurs when the president, in a almost unannounced way, goes to Walter Reed for unusual testing. So I'd like to hear much more of a fulsome explanation from Dr. Barbabella about what that testing showed. One other thing, I'll be very interested to see what testing they do today. because if they repeat some of the scans that have been done in the last year or so, then that tells us that they are surveilling something, and that's never been disclosed to us.
Very interesting. It's great to see you, Dr. Reiner. Thank you so much for coming in. Let's see what comes of it and what is disclosed.
CNN senior White House reporter Kevin Liptak. Kevin, the White House says this is all routine, but is it?
Well, you know, the president has now been to Walter Reed 3 times since taking office. He's actually had 4 separate medical checkups since he returned to office last year. After each one, the physician here at the White House gave him a clean bill of health, said that his health was exceptional. But that's despite, I think, you know, some of the visible ailments that we've seen pop up. You know, when it comes to his hands, the White House says that that is a result of a high dose of aspirin and shaking a lot of people's hands. The swollen ankles, they say that's a common vein disease. He's also treating a rash on his neck with some cream. And we've also seen him, you know, multiple times over the last several months appear to fall asleep during meetings, even though the White House said that those are just extended blinks. It has led to some concerns among the American public about the president's health when ABC asked Americans in a poll earlier this year whether the president is in good enough physical health to serve effectively as president. Only 44% of the respondents said yes. That was down 10 points from the fall. When they asked whether he had the mental sharpness that it takes to effectively serve as president, 40% said yes. That also was down from September. Now, the White House hasn't disclosed what exactly the president will be undergoing today at Walter Reed, beyond saying that it would be routine medical and dental checkups. We should note that he's been to his dentist twice already this year. They haven't said whether he will take a cognitive test. They also haven't said whether he'll go under any anesthesia for something like a colonoscopy, which would, of course, require him handing over power to the vice president. At the end of the day, Wolf, a president is not legally required to disclose anything about his health. If we do get results later today, those will be filtered through the White House, essentially only knowing what the president wants us to know about his physical condition.
Kevin Liptak at the White House for us. Stay in touch. We'll be back to you. Meanwhile, questions about the president's health have surrounded the White House now for several years. Here's what CNN has reported and what the president has said.
The president's overall health is excellent. His cardiac performance during his physical exam was very good. He continues to enjoy the significant long-term cardiac and overall health benefits that come from a lifetime of abstinence from tobacco and alcohol.
And he does have heart disease, is that what you said?
He does not have heart disease.
No, because he had a CT scan before that showed calcium in his coronary blood vessels.
He does. He did. He had I think so. Technically, he has non-clinical atherosclerotic coronary atherosclerosis.
That's heart disease.
Tonight, there are new questions about President Trump's health after he made an unscheduled trip to Walter Reed Hospital on Saturday.
I think anytime you have somebody who's in their 70s, who has a history of clinical obesity and a history of heart disease, if they show up for a mainly unannounced visit to the hospital, I think any medical professional would ask, why is that? What we hear he had done at Walter Reed, basic lab tests, those things could have been done at the White House.
So I think most of you have seen they released my physical. I did the physical on Friday, and I understand it was a very good report. The numbers were perfect. And I took a cognitive exam, and I would challenge anybody here to meet those marks because I have a perfect mark.
The White House press secretary revealing this afternoon that President Trump has been diagnosed with chronic venous insufficiency. The announcement coming after Trump, who's 79 years old, noticed mild swelling in his lower legs in recent weeks. Caroline Levitt reading a letter from the president's physician, Captain Sean Barbarella, also addressed bruising that's appeared on the back of Trump's hand, which they explained was due to his frequent handshaking and use of aspirin.
I'm also going to do a sort of semi-annual physical, which I do. And I think I'm in great shape, but I'll let you know. But I have no difficulty thus far. Is there wood around here? I'll knock on. No difficulty. Physically, I feel very good. Mentally, I feel very good. You got an MRI, it was perfect. Yeah. I mean, I gave you the full results. The doctor said some of the best reports for the age. some of the best reports they've ever seen.
A memo released by President Trump's doctor says that his cardiovascular and his abdominal health is, quote, perfectly normal.
What part of your body was the MRI looking at?
I have no idea. It was just an MRI. What part of the body? It wasn't the brain because I took a cognitive test and I aced it. I got a perfect mark.
Dr. Reiner, the president says that he takes 325 milligrams of aspirin a day rather than the 81 milligram baby aspirin, and that he's taking this against his doctor's wishes.
First, I don't love the fact that he's taking it against his doctor's wishes. Why is the president taking aspirin? He has never disclosed a history of heart disease. He's never disclosed a history of stroke or peripheral vascular disease that would warrant aspirin therapy.
Now, of course, I'm not a senior. I'm far younger than a senior. It's true. I feel the same as I felt 50 years ago.